Good morning, wherever you are. This is Amara Saul from ConferenceHype. Our segment will focus on cardiovascular benefit of continuous positive airway pressure according to high-risk obstructive sleep apnea, a multi-trial analysis. From the 2026 May 5 edition of European Heart Journal. Background, and AIMS. Randomized trials of continuous positive airway pressure treatment for obstructive sleep apnea in patients with cardiovascular disease have not detected reduced risk of major adverse cardiovascular and cerebrovascular events. Methods: in a post-hoc analysis of pooled randomized intervention with continuous positive airway pressure in coronary artery disease and obstructive sleep apnea. Impact of continuous positive airway pressure on patients with acute coronary syndrome and non-sleepy obstructive sleep apnea. And sleep apnea cardiovascular endpoints, study randomized trials. Outcomes were stratified by high-risk OSA status, defined by heart rate response following OSA respiratory events 9.4 BPM. Results: in 3549 participants, 16.6% and 16.3% reached the MACCE endpoint with CPAP and usual care, respectively. Discussion: continuous positive airway pressure preferentially improves cardiovascular outcomes in high-risk OSA, while harm in low-risk OSA may counteract this effect. From the 2026 May 21 edition of European Heart Journal. Background, and AIMS. Large-scale investigations with longitudinal data on infected native aortic aneurysms, a rare but life-threatening emergency, are lacking. Methods: a total of 2,387 hospitalizations for INAAs were identified between 2001 and 2021 in the Taiwanese National Health Insurance Research Database. Results: the cohort had a mean age of 73.8 plus, or minus 11.8 years, with 77.6% being men. Discussion: surgical repair is associated with significantly more favorable post-discharge survival compared with EVAR, underscoring the importance of open repair for optimal management of INAAs. From the 2026 APRA 22 edition of European Heart Journal. Background, and AIMS. Patients with cancer and venous thromboembolism have a high risk of recurrent VTE and anticoagulant-related bleeding. Methods: a systematic review was performed for randomized trials and cohort studies evaluating prognostic factors for recurrent VTE or anticoagulant-related bleeding in adult patients with cancer and VTE. Results: 33 studies were included in the meta-analyses. Discussion: the prognostic factors identified in this meta-analysis should be considered as part of risk stratification frameworks for anticoagulation management in patients with cancer and VTE. From the 2026 Jun 2 edition of European Heart Journal. Background, and AIMS. This study aims to provide the most comprehensive assessment to date of interventional cardiology practices across European Society of Cardiology National Society member countries, with a focus on infrastructure, procedural volumes, temporal trends, regional disparities, and adherence to guideline-recommended care. Methods: the third edition of the European Association of Percutaneous Cardiovascular Interventions, ATLAS, presents data from 50 National Society member countries, collected through a dedicated 2023 survey of national cardiac societies and interventional working groups. Results: despite the ongoing expansion of structural heart transcatheter interventions, PCI remains the dominant procedure, accounting for 90% of all percutaneous cardiovascular interventions. Discussion: the third edition of the European Association of Percutaneous Cardiovascular Interventions, ATLAS, highlights significant progress in percutaneous cardiovascular interventions across Europe, but also underscores persistent disparities.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 May 21 edition of European Heart Journal. Background and AIMS. Outcomes after surgical myectomy in hypertrophic obstructive cardiomyopathy patients have not been investigated in a multicenter registry with detailed clinical data. Methods. All HOCM patients who underwent surgery between 2012 and 2020 across 12 Dutch hospitals were analyzed using data from the Netherlands Heart Registration. Results. Isolated surgical myectomy was performed in 22%, surgical myectomy with one concomitant procedure in 54%, and surgical myectomy with two or more concomitant procedures in 24%. Discussion. Surgical myectomy with or without concomitant procedures effectively relieved LVOT obstruction in 93% of patients in this multicenter cohort. From the 2026 APRA-22 edition of European Heart Journal. Background and AIMS. Dual antiplatelet therapy de-escalation strategies improve outcomes after percutaneous coronary intervention compared to standard DAPT. Methods. Randomized controlled trials comparing de-escalated versus standard DAPT regimens in patients without baseline indication for oral anticoagulation reporting. Outcomes stratified by sex were included. Results. Overall, 272 patients from 20 trials were included, and 23.3% were female. Discussion. Sex may influence the safety and efficacy of antiplatelet de-escalation strategies after PCI, particularly those involving the shortening of DAPT. From the 2026 APRA-22 edition of European Heart Journal. Background and AIMS. Oral anticoagulation reduces stroke risk in patients with atrial fibrillation, but increases bleeding. Methods. Plasma samples were obtained from anticoagulation-naive participants before initiation of study medication. Results. A shorter lysis time was associated with being older, male, permanent AF, lower body mass index, estimated glomerular filtration rate and C-reactive protein, and higher N-terminal pro-B-type natriuretic peptide. Discussion. Shorter pretreatment fibrin clot lysis time independently predicted higher bleeding risk in patients receiving oral anticoagulation for AF. From the 2026 July 1 edition of European Heart Journal. Background and AIMS. Low-density lipoprotein cholesterol is a causal risk factor for atherosclerotic cardiovascular disease development and progression. Methods. VICTORION-difference. A Phase 4 double-blind, placebo-controlled randomized clinical trial included adults with hypercholesterolemia at high or very high CV risk. Results. Overall, 1,770 individuals were randomized to receive inclisiran or IOLLT. Discussion. An inclisiran-based treatment strategy was superior to IOLLT in LDL-C goal achievement, delivering early and sustained LDL-C reduction, with fewer MRAEs in individuals with hypercholesterolemia. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 23 edition of European Heart Journal. Background and AIMS. A simple diagnostic method able to reliably exclude left main coronary artery disease, or LMCAD equivalent, would would expand implementation of an initial non-invasive strategy in patients with chronic coronary syndrome. Methods in a multicenter case control study, CCS patients undergoing invasive coronary angiography after a maximal ESD were evaluated. Results: 335 cases were matched with 797 controls. Discussion among CCS patients, LMCAD equivalent can be excluded with high negative predictive value through a model based on clinical and ESD parameters, allowing initial non-invasive management of most patients able to exercise. From the 2026 May 21 edition of European Heart Journal. Antithrombotic therapy is essential after coronary artery bypass graft surgery to reduce ischemic events and prevent graft occlusion. Although aspirin remains the most commonly used agent in higher-risk patients, dual antiplatelet therapy or combining antiplatelet therapy with oral anticoagulation may be beneficial, but this increases bleeding risk. The choice of antithrombotic therapy should be tailored to each patient based on their ischemic and bleeding risks and regularly reassessed. Here, the scientific evidence underlying the key aspects of the choice of antithrombotic therapy after coronary artery bypass grafting is reviewed. Consensus statements for best clinical practice are provided, and areas requiring further research are highlighted. From the 2026 May 5 edition of European Heart Journal. Background and AIMS. The TRISC&D2 trial demonstrated superior clinical benefits for patients with greater or equal to severe tricuspid regurgitation, treated with the EVOQUE transcatheter tricuspid valve replacement system, plus medical therapy versus medical therapy alone. Methods: the multicenter, prospective TRISC&D2 trial enrolled 400 patients with symptomatic, greater or equal to severe TR, and randomized 2:1 to TTVR or control. Results: 1 year after TTVR, TR was less or equal to mild in 95.2% of severe TR and 95.3% of massive torrential TR patients. Discussion: patients with greater or equal to severe TR benefit from TTVR, experiencing improvements in TR severity, functional capacity, and quality of life regardless of baseline TR severity, with a signal for greater benefit in patients with more advanced disease. From the 2026 May 15 edition of European Heart Journal. Background and AIMS. Identification of patients with acute coronary syndrome requiring coronary revascularization can be challenging due to inconclusive electrocardiogram findings or biomarker results. Methods: a convolutional neural network model was trained on 144,691 ED visits from a U.S. cohort, tested on a separate test cohort, and benchmarked against clinician ECG interpretation and cardiac troponin T. Results: in the test cohort, the model achieved an AUROC of 0.91, outperforming clinician ECG interpretation and conventional cardiac TNT. Discussion: the model was able to detect revascularization and type 1 MI with competitive performance, suggesting a potential role to complement current clinical assessment.
This is ConferenceHype. Stay with us, coverage continues.
it for now for Conference Hype's coverage of the May 2026 issue of European Heart Journal. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.